Hey guys, welcome to another Lifestyle of Eden podcast. I am your host, as always, Nick Tognetti. And today we have returning with me my favorite doctor, Dr. Rajan. Thank you, Dr. Vik Rajan, for joining us today. We have a very exciting topic. I'm super glad to have you on this one.
Thank you, but thank you for having me.
So today we're going to be discussing a topic called integrative medicine. It is something that I have greatly leaned towards the last couple months, quite frankly, although I feel like I was always in it, but I'm really starting to, no pun intended, integrate more to it. Dr. Rajan, who is the MD in my practice, as I've said many times, he is board certified in pediatrics, which is for kids, internal medicine, which is for adults. He's a nephrologist, which is a kidney specialist, and integrative medicine. So I want to have Dr. Rajan explain this a little bit, and then I want to jump in and give my input on it, what we do with Lifestyle of Eden and so forth. So, Dr. Rajan, why don't you explain not only what integrative medicine is, but how did you get to there?
Yes. So integrative medicine is basically the integration of conventional medicine with other forms of medicine or healthcare, such as functional medicine, which is dedicated to root cause analysis and a more holistic approach to health, which is the main approach that I use for patients, particularly when dealing with chronic disease. I talk about frequently an algorithm of six, which is that most chronic diseases weren't caused by an evolutionary deficiency of Lipitor and metformin in our diet or the need for a cardiac cath or spine surgery in our lifestyle. But those diseases evolved because of problems with our diet, with our lifestyle. In an algorithm of six are called problems with nutrition, exercise, sleep, stress management, isolation, and environmental toxicity. This was the type of stuff that I learned when I was studying integrative medicine. And integrative medicine, it can, besides the conventional, it incorporates alternative medicine concepts, functional and nutritional medicine, the acupuncture, could be Ayurvedic medicine, which is ancient Indian medicine, Chinese medicine, acupuncture, chiropractic, any number of modalities. And so it's one is being aware of all of these and what they can do, what their limitations are, what their strengths, weaknesses, and so forth. And also for your own practice, figuring out what is it that you're going to incorporate, because you're not going to do all the different forms of alternative medicine because you have to get training for each one, for acupuncture, for chiropractic, all that. But certain ones, though, is that you may incorporate. For example, the functional medicine approach, nutritional medicine in particular. That's just, yeah. In fact, you don't necessarily have to be trained nutritionists. In fact, most conventional nutritionists don't even understand holistic nutrition and what it needs to be in order to improve chronic disease, because the conventional training in nutrition is
Very
flawed.
minimal, very
Yeah,
minimal. Yeah.
and
I mean,
and a flawed approach.
I just had a woman on a consult just 2 days ago who her husband is a doctor, and she said she says this about her own husband 2 days ago. She said, "My husband has 0 hours of nutrition under his belt as a doctor, and I've told my husband, hey, listen, when it comes to health and longevity and trying to get rid of my illness, don't tell me anything." She
Yeah.
said that to her own husband. And I started
Yes.
laughing. But it's interesting that you shared it differently this time than you and I have talked about plenty of times in regards to when somebody asks me what is integrative, I always say, what's integrating the conventional medicine approach with functional medicine? But that's only part of the truth. The whole truth is, no, it's really taking all facets of quote unquote medicine or these different modalities, such as what you said, chiropractic, and these different things, influencing them into what the client needs as an entire life protocol, and therefore you're integrating all these things. And that's interesting to me because I realize now I've been more integrative than ever. I just had a chiropractor on my podcast a couple weeks ago, and I have to put chiropractic stuff into my clients' regimens to get their nervous system regulated and all these different things. I've actually leaned greatly toward it, not only because of you, but I guess naturally realizing that's already my method of approach is integrated. Whenever you just hop in on one, we kick out all of the good in the other. And it's like that saying, don't throw out the baby with the bathwater.
Yes, yes. In fact, there's a lot of chiropractors out there that have gotten into functional medicine because they wanted to branch outside of their original training, which is basically manipulation of the spine. And they found that this more holistic approach with nutritional medicine and the stuff I talk about, algorithm 6, there's a lot more chiropractors that are doing functional medicine than there are doctors doing functional medicine. But said there needs to be more doctors. And so how I learned about it actually was by accident. And it was a friend of mine from residency. He was studying this and he learned about it. And it was about integrative medicine. And he asked me, "Hey, would you like to get your fourth board certification?" Because he knew I already had three, which is quite a lot for a lot compared to most doctors. And I said, "Sure, what? But I'm not doing another residency or fellowship." He said, "You don't have to. There's this field called integrative medicine, and you basically it's just a lot of coursework and that you can do online and video classes, and then you may join a practice that to get some hands-on training with it.
Yeah.
You take a test and then you get board certified. At that time, it was called American Board of Integrative Holistic Medicine. That was back in 2013, 2014. And in fact, that corresponded with one of the first cases I did that involved a functional medicine approach. I remember it was this lady in her 20s. Her dad found me because she was having problems with bile reflux, which is different from acid reflux. It's not stomach acid, it's bile acid, which she had as a complication of gallbladder removal.
Bile,
Yeah,
Bile, with the liver.
bile.
Okay,
Yes, she
bile.
was refluxing bile, not stomach acid, bile.
Interesting.
And
Interesting.
so she had some gallbladder removal procedure, which she may not have needed in retrospect, based on what she was telling me about it. But it was done. So what's done is done. But now she's having this problem of that the bile was refluxing into the stomach. It was major irritation. She would be throwing up every day, going to the emergency room once a month for dehydration. She had several gastroenterologists she'd seen. She was on like 5 different medications and still symptomatic. And so her dad found me initially as patient advocacy, right? And to say, hey, maybe you can help us find a bile reflux specialist somewhere who can deal with this. And for example, this was actually controversial because, in the sense, not all gastroenterologists believe in bile reflux. And so
You don't, in theory, it makes a lot of sense. You and I were just talking about another client with the gallbladder just the other day. And so if the bile is produced, or if the liver is producing bile and the gallbladder stores it and there's no gallbladder there anymore, but if the liver is continually producing and overproducing, where's that bile going to go, right?
oh, right,
It's going to start to creep up the esophagus or do anything else for that matter.
it
So
potentially can, and
that's an
that's exactly
interesting
what it
thing.
was.
Well, then let's talk about that just for a second. And then I want to come back to the 35,000 foot view of integrative. So, in that context, that's a very, Dr. Rajan, that's 1 in 10,000 people right there. That's not normal. So,
Yeah.
what was the approach for a bile reflux? You can't shove the bile back in the liver. So, what do you do?
So a lot of it, my approach at that point, because I realized I don't think another specialist is going to be able to help you with this, because this is more of a nutritional medicine and lifestyle
It
approach.
is.
And
Exactly.
so we had to change the way that she was doing things. Like, for example, she would sometimes skip meals, she would take alcohol, she'd smoke, and things like that. Then I said, okay, we got to clean up everything. We also got to clean up your diet. You got to don't skip meals. Try taking yogurt, which is actually pretty soothing for the stomach. Used in the South Indian culture, we use that frequently for folks who have reflux and gastritis issues, and all these things that we had to put together. Right? Once you quit alcohol, quit smoking, stop skipping meals, try yogurt, avoid spicy foods, avoid foods that can trigger reflux, of which there's a number of them. And then she actually started becoming asymptomatic within a few weeks of successfully incorporating all of these things. And
I was
by
going to say that one of the biggest things, probably, obviously, you want to check the liver from from multiple points of view. Like, you want to see what the bile ducts are doing, but also, like you said, not skipping meals, because you want to use up that bile rather than it piling up. Bile digests fats. So
yeah,
you want to make sure that your diet is not to where you're going 7 hours without eating. You want to make sure you're using up that bile that's coming in. How are you going to use it? Probably by being able to throw in a little bit more fats into the diet and so forth, so that it actually has something to use, right? So that is totally a functional nutritional concept. There's no medication you're going to give the liver to say, hey, stop producing bile. In fact, you don't want it to do that, because then you're going to have an extreme on the other end.
Yep, yep. And other things like ginger, I remember talking to her about that and utilization of that, whether it be teas or those pieces of ginger and incorporating that.
Why'd you want to go ginger?
Ginger, I remember that being something that also helped in terms of being more prokinetic. And
No, it is. It is. In fact, that's why I was asking was because we'll give it to after gut health cases. We'll give whether it's Motil Pro or some other prokinetic. You have low dose naltrexone, you have ethromycin, you have some of these different things that do that. But if you do 1,000 milligrams of ginger twice a day, this
yeah,
is a prokinetic to keep food moving,
yeah,
going throughout the system.
yeah. All these things, and I was at that time, I was just learning this stuff. I was like in within the first few months of learning this, so I was just pulling stuff at the top of my head. Like, if we do this, we'll put this and stuff. But I didn't have a lot of experience in it at the time, but in her case, it worked.
But
And
Dr. Rajan, so I literally just had another guest on a podcast about a week ago, and we discussed that listen, every medication that's ever come out, every illness that's ever come about, every disease that's ever come about, at some point came about where nobody knew what to do with it. And so you
yeah,
were guessing and experimenting according to the knowledge that you have of physiology and connecting certain dots and this, that, and the other. That's what that's I've actually had to do that a lot in my practice, but I experiment on myself. But where you get things and you go, hey, listen, this case is not very popular. It hasn't been dealt with exactly, but I know that this does this and this does this. Therefore, let's connect the dots here. And I always say, every drug at some point has been an experimentation on
yeah,
people.
yeah,
Okay. Every illness has at some point been experimentally treated, whether success or failed. So what you got was no different. And you saying, hey, I didn't really know what to do at this point, but I had enough knowledge to connect these different dots. That's what medicine has been all about
yeah.
for 5,000 years. And we're
It's the
still
art of medicine. It's the art of medicine.
exactly.
And what amazed me was that it worked because again, if you've been to the gastroenterologist, you've been on 5 different medications, none of that was working, and this approach was working. And again, I wasn't trained on this to the point where I was like, oh, I know this works for this. I was just learning it and then applying this to this first case that I had, and it
Right.
worked so well that she got off half her medications within 6 months, and then she got off all her medications within a year. And as long as she adhered to those dietary and lifestyle recommendations, she never had a problem again.
And that's the key right there is adhering to the fact that what got you healed will keep you healed,
Yep,
right?
that's
This is integrative is interesting for a couple reasons. So I got to tell you, I'm at this point now where I'm literally debating on changing the known title of my practice from a functional nutrition practice to an integrative nutrition practice because, for example, I partner with a nationwide clinic. I have you as an MD within my practice. I use chiropractic. I have chiropractors around that I do this, that, and the other. And the reason being is because in the functional space, it's almost like at the head, you have the functional, facing the conventional, and they seem on the surface to be rivals against each other. The people over here don't like these people. The people over here don't like these people. They're pointing the finger at this, that, and the other people for being wrong. And do I agree that much of the conventional approaches have been borderline worthless when it comes to longevity and prevention? Yeah, I 100% I do. I stand pretty strongly on that. But do I throw the baby out with the bathwater? No, because there's certain things that the conventional space has broken through into, and certain medications and different things in certain scenarios and within moments, while the functional perspective deals with the root cause, can really be good if you can use both. Like me in my practice, I'll sometimes send people to the clinic that we partner with to say, hey, you have a CRP of 8 right now, and it's from a gut issue. I need to lower that down manually while I deal with the gut issue. Let's go get on low dose naltrexone to lower that temporarily while I deal with the gut. Then after we finish with the gut, we can come off the LDN. But that's where you're integrating these different approaches to help the client short term and long term. And I really, you've been the one that's really pushed it on me, but I've really become a major advocate and practitioner, if you will, of the integrative approach. And I think that's why one of the reasons why God has you in my practice is those approaches are so needed. You and I were just talking about a case the other day where one of my clients, she's so disgustingly radically fed up with the conventional medicine world and this, that, and the other. And she was the one with the bad tinnitus with the hypothyroid that I told you about. And you had said, hey, send her to a, what was it, ears, mouth, EMT, ears,
EMT.
mouth, ears, mouth, throat doctor, right? And I told you on the phone, I said, Vic, I want you to understand some context here. If I was to bring that up to this woman, she would freak out. I go, she is so angry and emphatically against the conventional medicine world because she's struggled with them for 30 years. I understand her opposition, if you will, but I go, I can't just bring that up. And so I had to slowly sit down with her, talk to her about all these different things. But at the same time, it's like, hey, you know what? If there is a tumor or cancer or this, that, and the other, guess what? My intake forms are not going to be able to spot that.
Yeah.
Like we may need to go get that. And then how we want to go about approaching that, sure, we can go conventional or we can ignore that, but at least we have a little bit deeper insight because of the tools that the conventional medicine world has. And then while we're dealing with the stress and this, that, and the other, we can influence chiropractic, and she does acupuncture, she does all those different things. So I've become a massive fan of integrative. And like I said, although I still call myself a functional nutrition practice because I really am. I deal with root causes, but that doesn't isolate me to functional because I deal with the root cause still through a very integrative way, meaning, hey, we may have to bring in some band-aids from the conventional medicine world with prescriptions temporarily while I functionally deal with the root and this, that, and the other. So I think that there's a marriage between all of these worlds that needs to happen. And I think that people like you and I are really being able to start doing that. You and I talked about it before. There's literally no functional nutrition practice out there. I know the top ones, by the way. There's no functional nutrition practice out there like this that has an MD on the payroll as a consultant doing this, that, and the other, going back and forth, integrating medicine, all these different things. And I think that this is a bridge and a marriage that really needs to happen, because if we can get to where we can speak up against certain things that we don't agree with the conventional medicine world. But guess what? I can also speak up against things with the functional space that I don't disagree, that I don't agree with also. So bringing the best of all of these worlds, I don't want us to become so emphatically against one thing that we're blind to the benefit that's within that field. You know what I mean?
That's correct. Now, Bruce Lee famously, he trained in a martial arts kung fu, right? When in Hong Kong, China, and when he came to America, though, he wanted to learn every different form of martial arts, and he basically combined it into like Jeet Kune Do, which is basically it was like predecessor of mixed martial arts, in the sense that he was taking every different field that he learned and putting the best aspects of it together. And he got a lot of heat from purist practitioners, whether it be kung fu or karate. This is, you cannot mix the two. It's either one or the other. You pick one. It's like, no, that's not how it works. It works better if you combine the elements together. And that's why that's how MMA is basically. They're not just one martial art, another. The best practitioners are the ones who combined everything. And those are the best fighters in the world.
And you know what? Maybe what it's about is obviously if an MMA guy goes into a boxing ring, he's going to get destroyed with the boxer because the boxer specializes specifically in that one craft. So what if we have practices where one person specializes in functional, one person specializes in certain things like you're doing, or this, that, and the other. And in that one practice, we all come together and we can handle these complex cases and this, that, and the other. And that's where the saying is, I use it in nutrition, but the whole is better than the sum of its parts.
Yes.
Like we can go and get vitamin C from this, that, and the other, but what if I got loaded with vitamin C from pineapples and oranges with the phytonutrients and with all of its fiber and everything else that it has to offer? How much more bioavailable it's going to be.
Yeah.
No, I agree. I think that there's so many benefits in all of these different things. And you might be one. I don't know another integrative medicine doctor, quite frankly. And I don't know many people that do. But whenever I was just speaking with a big functional practitioner the other day, I was telling him about you. And I said, yeah, he's integrative. And he goes, dude, that is awesome. Because you're literally marrying all of these best worlds. And what better time right now, Vic, which me and you will have probably a lot of talks about this offline, but there's no better time right now to be integrative than now. I would have said 6 months ago, there's no better time to be functional than now. But now I'm saying integrative. And because For example, I've used multiple different kinds of peptides, right? Like AOD, epimorelin, CJC, all these different things. And these are all fantastic products. They're absolutely fantastic. I've studied them, I've done them. And then we have other things like SLU-PP332, which is another compound for metabolic function and all these different things. But if you can utilize all of these different tools to get some of these most complex cases under wraps and then on the right path, and then you can come off those things as you're fixing these lifestyle habits and everything else. I mean, at the end of the day, those peptides and those different things, those are integrating. That is integrative medicine. It's like the semaglutides and stuff. I had a whole podcast on semaglutide the other day, and I had said, look, I'm not against semaglutide at all. I go, if it's needed in its proper micro dosing in these different things with lifestyle changes and habits, I go, it can serve a very great band-aid for a very temporary part of time. I go, the way it's being used in the conventional medicine space, yes, I disagree with the way it's being used, but I don't disagree with the drug in and of itself because it doesn't need to be. It's a GLP-1. That can be a very phenomenal tool when somebody is having very high cortisol, they're running on sugars, their glucagon is through the roof, and this, that, and the other, and then we're needing to fix the lifestyle habits, pull down inflammation. They're a crazy type 2 diabetic that maybe temporarily we need to do that while we deal with the lifestyle. So then when we pull them off, they don't go back to type 2 diabetic and everything else. But I think all of these different things are so important because we're coming out with so many. You and I have talked about it, rapamycin, an anti-aging drug that sirolimus, right? The medical term that you would use for, say, a kidney transplant, heart transplant, whatever it is. But in micro doses, the autophagy, it's the number one form of a drug on the market for autophagy, or these peptides that are doing these different things. So I think right now, being able to be on top of all of that and how to use that, and then that way, not only does it make you effective in being able to handle all the cases, but it makes you effective in being able to work with any client, because I have some clients that they will say, Nick, I'm against medication. I don't want to do it. Okay, great. I know how to take care of your case without it. But then I have some other people that say, hey, Nick, I want to use the medications or whatever because I don't have 6 months. I need to figure out how to do this in 10 weeks. Okay, then we can start to implement some of this. So it gives the flexibility for you to work with these people where they're at with what they want to do. And so, like I said, there's no better time to be integrative than right now.
Yes. And not only that, another important aspect to realize in terms of the use of conventional medicine is for when there are acute medical emergencies. And I've said this before, and
Don't
I
go to
have
the
joking, but it's true. If you're having a heart attack, don't go to the naturopath for some herbs and spices. Go to the emergency room, get a cardiac cath, get your life saved, and then you can talk to a functional nutritionist about the inflammation that you had that led to this, because it's not simply a cholesterol issue that you're going to fix with Lipitor alone, but recognizing when there's an acute medical emergency or that it's going to be coming soon. That's I work in emergency room for half the time, right? And so see this all the time, and that's where our conventional system is very effective. It's not very effective for chronic disease prevention and management, but it is very effective for acute medical emergencies and stabilizing. If you're having a bacterial pneumonia, antibiotics, they work. And when we didn't, in 100 plus years ago, when we didn't have that, people just had to hope they made it. And some did, and some didn't.
The 1930s, the leading cause of death was infections because we didn't have these things. The advent of antibiotics in the 1930s totally transformed what the leading cause of death was from the 1930s to the 1970s. These things all play a different role in everything else. Let me ask you, when do you think, because I didn't really come across the name per se as a profession until me and you several months ago, but when did like this, the concept of integrative medicine has been there because there's multiple people that are like, hey, I'm going to take this, 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 like your Bruce Lee.
Yeah.
But when did that become like a thing, like a real thing?
My understanding, there was a entity originally called the American Board of Integrative Holistic Medicine. That's been around for, I think, a couple of decades, probably since the 90s.
Wow.
The concepts of integrative medicine have been around as early as the 70s, but to the point where they incorporated it into some sort of unofficial accrediting board. I think that was in the 90s that they started that. And they were the only place where MD physicians could get trained in and learn about integrative medicine, and then they get some practical experience by going into a functional or integrative practice, and then taking a board exam, and then they would get a diplomate or certificate in integrative holistic medicine. Now, eventually, that became recognized by some of the more official medical accrediting agencies in Texas, at least. There's a there's an accrediting group called the American Board of Physician Specialties, which is there's two major ones. I think American Board of Medical Specialties, that's the big one, and then American Board of Physician Specialties, that's a smaller one. But they've incorporated some, besides some of the, of course, many of the conventional specialties, they're willing to incorporate some of these lesser known fields like integrative medicine. They said, hey, we like what you're doing. We'd like to incorporate this and make it official because they're recognized by state medical boards, their accreditations. So the American Board of Integrative Holistic Medicine was unofficial. It wasn't recognized by state medical boards. So
Yeah.
that moved over to American Board of Physician Specialties. In fact, at that point, so to get into that, if you were already boarded with the American Board of Integrative Holistic Medicine, then you'd get grandfathered in if you were still practicing, and then you just took another board exam and stuff like that. If you were not already practicing, not already board certified, you'd have to actually take a fellowship, which there's only a few in the country and none in
Wow.
Houston. There are no programs in Houston. So, you'd have to take a fellowship and then take the exam. And so, but I got grandfathered in because I was still actively practicing. And so now I can say I'm board certified in integrative medicine, and that's recognized by the Texas Medical Board because they recognize the certifications coming from the American Board of Physician Specialties. So it all moved over to there. In fact, I'm due to recertify next year. I submitted my CMEs to take the board next year and pass that, and then get another 7 years. That's their accreditation, 7 or 8 years, something like that. But yeah, so that's what it is now. So it is
It's a very recognized, it's a very recognized thing. I think that it's probably still seeping into the public as far as its knowledge goes. Like functional, that space has blown up in mindset the last 2 years, and it's still oversweeping everything. But one of the things that I want to do to be able to stick out like a sore thumb is everybody knows, hey, Nick's functional, but yet he integrates
yeah,
these other concepts. And I think that being able to learn and study those things, like my cousin's a chiropractor, right? And so I integrate chiropractic very heavily into my practice with clients and this, that, and the other. But like I said, being on top of all of these huge things that we have coming out right now, like these different peptides. I use the peptides differently than others. Some people like to live on them. I don't agree with that. I would love to live with no medication, but to
yeah,
utilize certain things to say, hey, you know what? I'm going to go 45 days on this and get a little bit of an edge or whatever. Okay. And then come on. Okay. There's these different protocols and things that you can do to really be beneficial with all of that. And then it's also just lifestyle. Like for me, like I have a lot of clients that they okay, here a guy that I'm working with right now, right? So he's not able to work out at all because of certain immune system issues and things that are going on. In order to not only help him stay lean like he is, but to even maybe get a little bit leaner because this person is a very high profile individual that has a lot of photo shoots and different things. Hey, guess what? He can't work out and do all this stressful cardio, and I can't stress his body out through a low diet or anything of that nature. So what can you do? You can do a SLU PP332 or like CJC epimorelin, something like that, a peptide or a compound that's going to maybe help him burn a little bit of body fat, even though he's not training for that certain season or time or thing that he's in. And then that way you're making these clients happy, but you're keeping them healthy and you're teaching them how to do things to where you're not having to live on those compounds. Hey, let's get back to the lifestyle, your algorithm of 6 or my 7 pillars, those different things. And whenever you're doing that, I think that you really start to hit the spectrum on the head in a way that I think is going to become very prevalent over the next 2 to 4, maybe 5 years. But I think that the concept is known, but there's still so many, it's so easy to swing to one side where even for me for a while, there was a side where I swung so hard over here that I was pretty vocally against a lot of the conventional medicine world because I was failed in that world many times over and over again. But yes, was I failed in that world many times? I was. But does that world still have plenty of awesome things that we need to be offering? Absolutely. And so sometimes it takes time for us to be able to blend all of that and balance all of that to where it can be useful for the public like we're doing.
Yes, yes. And I know it was, in fact, and how it began, as we talked about before, was when you met me when I was on call in the ER one day.
Yeah. Yeah.
And I was able to help you out there. But then you were talking about, oh, some things like, you probably don't know this because this is functional. I'm like, oh, I know. I'm integrative medicine. I'm like,
Yeah.
how do you know this is this? And then that's how we got to know each other and how we're here today.
Yeah. But this is integrative means the conventional, it means this. But the big thing about integrative, and it has to be the foundation of all of it, is nutrition. And
Yes,
this is the part that, because look, there is no healing, there is no reversal, there's no none of this stuff without nutrition. And so this is the part that still blows my mind away. That, like I said, I just had the consultation with a woman on Friday. She said, my husband's a doctor, he has 0 hours of nutrition. And I literally have told my husband I will not listen to him when it comes to longevity, health, or well-being. When it comes to surgery, okay, great, he knows how to do it very well. But that blows my mind still, that the most important foundational principle we don't have in the biggest medical system in the world. So
yeah,
I think the first concept that we have to learn is we've got to learn nutrition. We've got to learn how to balance these different things. Because like you said with the case that you brought up earlier, the bile reflux. I've never heard of somebody actually literally having bile. Now, can it be a thing? 100%. You literally just have to have too much bile that's causing a reflux within the esophagus because it's not being used or whatever it is. It's the same way as like acid reflux in certain regards, although acid reflux is pretty misunderstood in the medical world. But those different types of things, what did you have to do? You realized, hey, listen, what am I going to do? Cut your bile ducts out in your liver? No, you can't conventionally do anything about that. That is a functional nutrition lifestyle slash integrative approach because it might have to do with the nervous system regulation. It might have to do with chiropractic and relieving stress and going out in nature more or doing these different things. But you're having to integrate full lifestyle. And that's the thing that my business is called Lifestyle of Eden, right? It's not nutrition of Eden. It's not medicine of Eden. It's lifestyle because taking care of all these things. And that's why I realized like it started hitting me. I go, dude, I've always been integrative. I've literally always been integrative. I just didn't realize that was the name.
yes,
But that's why my practice, I think, has been so successful with a lot of these clients and why you and I have been so great working together is that we're looking at the whole lifestyle. And as a pastor, and I'm also a doctor in the faith, I just got which I don't even think you and I have talked about. I just became a doctor like 4 weeks ago.
congratulations.
Thank you. So now with all of that, I'm constantly doing therapy with these clients. They'll get on consults with me. They'll tell me about this, and I've got to teach them boundaries. I've got to teach them stress relief hacks and all these different things, right? Lifestyle habits and so forth. And so these different types of things are really what's going to change somebody's life. When we just write the best protocol, the best nutrition, the best medicine, this, that, or the other, you're never going to outright a poor lifestyle or a lifestyle that is deficient in a certain area. And like I said, that's where your algorithm of 6 or my 7 pillars, that's where you have to confront that situation. I don't care how many vitamins you take, how good you eat, or how much you work out. If you're not sleeping,
Yeah,
there's a problem, and you're not going to be able to out protocol not sleeping.
Yeah. Yeah.
So that's awesome, man. I love it. Like I said, I've become much more of a fan of integrative, and I want the people that are my listeners and everything else, I want them to become more conceptually familiar with integrative medicine and or integrative nutrition and this, that, and the other, because I really think that it is the best way to go. I think it's going to be the most effective. I think it's going to reach the most people. It's going to be the most practical for people. I have some people that come to me, and I'll give you an example when they come to me with their gut issues, right? And I have to give them a 5R gut protocol. Well, 85% of them, I do the antimicrobial herb protocols and I'll write the entire thing out and that they'll be fixed up, right? But that kill off phase can take 6 weeks. And then I have to do like a 4 week refeed to refeed the gut microbiome up. Some of these people, like one of my women I just had, she's a major entrepreneur, super busy. She didn't have 6 weeks. She was like, Nick, I literally don't have 6 weeks. I'm going to be leaving here, going there, doing this, blah, blah, blah. So we had to put her on the antibiotic protocol. Now, granted, I said the antibiotics that I needed her to go get from the clinic, in which case the clinic still has to prescribe that. I can't prescribe. But she went and got that. And guess what? We knocked it out in 14 days. And then we were able to refeed the gut. So we knocked it out and refed the gut all within 6 weeks. Whereas the antimicrobial herbal route, the kill off phase alone will be 6 weeks. So with that client, guess what? We had to integrate all of these different concepts to make sure that we got the end result, which was that. So I think that the more that people become aware of this, I think that your practice, concierge integrative medicine, and becoming people's doctor outside of, say, the doctor's office, if you will, is going to become not only needed. I think, Dr. Rajan, that you're going to have to become the entrepreneur that raises up a lot of doctors underneath you within your practice,
Yeah.
because there's not going to be enough you to go around. I think that is going to be hitting the ceiling very soon.
The ultimate goal, the end goal, this is going to take years. I know that, but it's okay. I've got the time to and patience to see this through. You have to make an integrated center that where, and they have this in other parts of the country. I know they have it in California. They have it in some parts of the East Coast as well. They don't have it in Houston, ironically, home of the Texas Medical Center, biggest medical center in the world for conventional medicine and procedures. They don't have an integrative center, but that's what you need to have, and takes takes time to build something like that up. First of all, it takes a lot of money, and then it also takes a lot of soft influence, getting it into an academic center and then introducing it, having them test it out, see, hey, this is actually working in ways that our conventional approach is not, to where they believe in it enough to where, you know what, maybe we should do that. You start off with a department, and then eventually it grows bigger, and then it becomes more popular, and then you have an entire center where everything is incorporated. Now, that's something that could take a decade or two, to be honest, because especially if you're starting it from scratch. And Texas, like I said, is not a place that's known for holistic, integrative medicine. But if I have any say in it over time with the different projects I have going, maybe eventually it will be.
Yeah, and honestly, as I start to get invited more to these conferences and speaking and guest speaking and this, that, and the other, there are things that I'd love to bring you with me on so that people can really start to hear what we're doing in such a powerful way. Having an MD within my practice is such a vital tool that for me and for my clients and everything else. And like I said, there's not much of a marriage of the functional space with the conventional medicine world. The closest that the functional space has with conventional medicine is with nurse practitioners through these clinics. And the nurse practitioners are awesome. I love them. I'm very close with many of them. But there are many things that they do not know that a doctor does, just flat out, that it is what it is. I do love how they're open-minded. They're always learning the new things. They're learning the newest drugs, the newest peptides, the newest protocols, the newest ways. That's one thing nurse practitioners have a very good thing at, is they're always learning the now. But to be able to have all of it together, I think that you really start to hit a song that will be sung by everybody, that's going to meet everybody's criteria and needs to get to where they need to be, regardless of where they are currently at. So No, this is awesome, Dr. Rajan. And as always, you always present the top line information. Everybody has been loving the podcast that me and you have had so far with our T4 to T3 conversion, our IgA nephropathy, and chronic kidney disease. We also had another one, our first one, in regards to the 6 pillars that you present on your website and everything else. So thank you so much for coming on with me today. And I'm really looking forward to our next topic as well.
Yes, thank you for having me, as always.
Yeah. And so, guys, just for the viewers, you can check out Dr. Vajan. His information will be down below in the write up section. If you want to check out his website, I highly recommend it. If you're in Texas, I highly recommend you getting him as your personal doctor. He can help you out in many ways. And also, if he doesn't have the answer, he can definitely get you the answer, no doubt about it. He's very well connected. Like I said, he's board certified in 4 different areas. That's very rare to be that loaded with board certifications. So stay tuned, guys. Thank you so much for joining, and stay tuned for the next episode.